We are here today with Dr. Mehran, a cardiologist with Lima Memorial Heart and Vascular Institute. And first of all, doctor, thanks for joining us today. We're going to talk a little bit about cardiovascular disease and same-day appointments. Now, first of all, doctor, what are some of the most common symptoms of these heart conditions?
Good morning. Thank you for having me. For the most part, cardiovascular disease, as the name implies, are the illnesses that pertains to the heart and the vasculature that feeds the heart or feed the organs in the body. So the symptoms that patient may have, I like to divide them into three areas. One would be those that are more manifested in the chest pain by symptoms of angina type symptoms. The second type of a problem would be shortness of breath, and the third one would be those that are due to the electrical function or malfunction of the heart, palpitations, lightheadedness, or irregular heart rhythms. Variety of these different symptoms can be seen, and different people perceive and report them completely differently. We know that, for example, women or the diabetic patients, they commonly experience those symptoms in a different manner than a typical average individual would, and therefore it's important for us to pay attention in that context to whether or not those symptoms are truly reflective of a heart problem.
Okay, so what if someone needs further care for their heart condition? What are some things they might expect to be going through?
Depend on which one of these areas we're talking about. When they come to the cardiologist, when they come to any physician, our first role is to establish a differential diagnosis, meaning come up with basically a laundry list of things that could be causing their problems. Once we establish those, which would be based on their age, their risk category, and the symptoms, then the second part of it would be ordering tests that would one by one assess and exclude each and every one of those possibilities. And then lastly, once we focus on one likely cause and etiology, then the treatment phase would start, and that could be something that would basically entail either medication or subsequent procedures in order to fix the problem.
I know you talked a little bit about the symptoms, and they're not always the same for men and women, are they?
True. For example, diabetic patients commonly don't experience chest pain, even if they do have angina, if they have blockages in the arteries of their heart. Their symptoms would be more manifested with the shortness of breath with activity, things that, for example, nausea or vomiting is a very common symptoms even when they are having a heart attack. Often they present themselves to the emergency room with a slight delay as a result of this. Women may not experience the typical chest heaviness. They may have some atypical form of the angina, discomfort in the arm, discomfort in the neck and jaw, as opposed to a typical heaviness on an elephant sitting on my chest feeling. And in my years of experience, I know that when it comes to electrical problems of the heart, no two people describe those in the same fashion. Either they don't feel it or perceive it, or their difficulty in expressing what they feel can mislead us into going down a wrong path. So it's very important that we get a very thorough history, put that in the context of the risks of that individual patient, and then come up with a diagnosis. And that has to be tailored from individual to individual.
Dr. Arapur, we thank you very much for your time today. We've been talking a lot about same-day appointments. If you'd like to schedule one, you can call the number on your screen or go to limamemorial.org/same-day, and you can get more information. Thanks for your time, doctor. We appreciate it as always, and we'll be back with more right after this.